Food banking really is a dynamic sector in a lot of ways. We've gone from the basic premise of rescuing food that might otherwise go to waste and getting that food to people who need it, to thinking bigger, more holistically about how do we not just feed the line, but actually shorten the line.
It's not just providing a meal for people who need it today, but helping them to be able to feed themselves tomorrow.
And so with us being able to prioritize certain social determinants that our communities pointed out, we have a greater focus and we have an ability to pull together partners and key stakeholders that are going to help us tackle those and hopefully knock them out.
Part of the mission of the Federation is to engage partners to end hunger in the Commonwealth. That's right there in our mission statement. So how can we work in partnership to start to address some of those root cause issues?
There is a role that all of us can play. We work with partners in healthcare, in financial literacy, in housing support, and I think together, all of us bringing our collaborative expertise really can have an impact on the needs in our community.
We all believe in continual learning because times change. We've all seen that over the past 18 months.
Early on in the pandemic last year, we were not seeing the number of corporate volunteers that we typically have, and we were not seeing the number of corporate donations that we typically receive. So that Sentara developed this We Care program. They put together the resources so that we could provide We Care boxes.
We had just seen a huge spike in food insecurity going from 9% to 22% in just a matter of a few months, huge job losses, and it was really an innovative food delivery system that allowed us to do these low-touch distributions in a safe way. And a year and a half later, we have distributed over 200,000 boxes to people in need. In my career, I have really seen the power of public-private partnerships, and I think We Care is just one example of how that can work.
Our goal is really to trust people who do their best work to do that work. And by building those partners, it allows us to be able to continue to look at ways to meet people in their communities and where they live.
The whole is greater than the sum of its parts. Working together, we can elevate everyone's respective work. At the end of the day, we want to benefit all Virginians.
Looking at health equity and health access and the intersection between food access and health and what we can do to make a difference there. That's what this boundless collaboration is really all about.